First time seeing you.
These specialist nurses are treating their first suspected coronavirus patients here. Not normally used for emergency care, this is a children's ward. It's been cleared to free up space. After spending just 20 minutes on the ward, a potential COVID-19 case arrives.
We've got a blue call coming in. COVID.
A blue call is coming in, warns the nurse. This is the reality of working on the front line and managing huge numbers of patients. As staff prepare for their next admission, the government scientific advisor was telling a committee of MPs 55,000 of us could have the virus already, and they're doing everything to limit the number of deaths.
So if we can get this down to numbers 20,000 and below, that's a good outcome in terms of where we would hope to get to with this outbreak. But I mean, it's still horrible. I mean, that's still an enormous number of deaths, and it's an enormous pressure on the health service.
In order to relieve that pressure, the head of the NHS announced unprecedented measures to free up 30,000 beds.
We are suspending elective non-urgent surgery with an assumption that that will be suspended everywhere from 15th of April at the latest for at least 3 months, but with discretion for hospitals to take action earlier if they need it.
The chair of the committee then read a letter from a hospital doctor describing the shortage of personal protection equipment.
It's absolute carnage in A&E, utter chaos. We don't have any proper PPE. We're being given paper masks, not the gowns, not the FFP3 masks we need, and not everyone even gets those. I'm in shock. I feel like we're being thrown to the wolves here. Some of us are going to die.
As we sit here today, nationally, the Department of Health and Social Care procurement team have sufficient for the PPE that we're going to need over the coming weeks. But there is a distributional issue around the country, and we are going to need more of it.
They will also need more ventilators to fill these makeshift emergency wards. There are plans to increase the amount of vital equipment to 12,000, but right now those working in hospitals are extremely worried about the sudden ramp-up of resources.
If you're trying to do that and you need to upskill people very quickly, what we're looking for is very clear guidelines from the government on how that's going to happen, because without that it's just contributing to an overall level of anxiety.
There was some guidance from advisers today as the government responded to claims ibuprofen could worsen the effects of the virus.
It may or may not be right, I don't know, but the sensible thing to do, I think, would be to say, well, don't take it at the moment, take something else, paracetamol or something.
Desperate measures are now in place to try and allay anxiety in the health service. This children's ward is ready to take critical patients in what some may say are desperate times. Emily Morgan, News at 10.